I would like to request the first speaker, Dr. Ajit Hazari, to start with his talk.
Can I have the screen, please? Yeah. Right.
He is talking about basically the use of swept source OCT based biometers, how to get the best from SS OCT biometers.
Thank you, everyone. Today we'll be going over the SS OCT biometers that are available to us to use in our practice.
Can you make it a little louder, Dr. Hazari, please?
Yeah.
Louder.
So if we look at the swept source OCT biometers available to us, we have 4 machines that are available to us. That's the IOLMaster 700, the Argos, Anterion, and the iStar. And I'll be speaking more on the Argos because I have a 18-month user experience. Common thing amongst all these biometers is that they all have a faster acquisition. They give multiple parameters. They have better penetration compared to the previous generation, and all of them are preloaded with advanced new generation formulae. Why are these advanced new generation formulae important? That's because if you look at the traditional previous generation formulae, they use the ultrasound axial length, and they tend to give hyperopic errors in long eyes and myopic errors in short eyes. The newer generation formulae, on the other hand, have algos in them, like the Barrett Universal 2, which we are all using, and the Hill RBF2, and they counter for these errors which occur at extremes of the axial length. But the downside of the newer generation formulae are that they require a large number of parameters, and this is where the new generation biometers come into play. So on an average, they require at least 5 or 6 parameters to calculate. So we've been using the Argos for more than 1.5 years now, and what it does is that within 1 second, it can give a single reading which covers the ACD, keratometry, corneal depth, corneal diameter, the CCT, axial length, which is sum of segments rather than the ultrasound, and the aqueous depth, pupil size, as well as the lens thickness. So throughout the measurement and the analysis, the Argos gives the user the control to evaluate the measurements as well as to change the quality and the measurements later on during the analyze mode. So this helps monitor the patient alignment and fixation for enhanced measurement accuracy at the time of acquisition. So here is an example which I did recently, just a couple of days back, with my junior most optometrist doing the biometry, and he got 5 standard readings within 42 seconds. And mind you, each of these readings consists of 3 additional readings. So that's a total of 15 readings in 42 seconds, which were within acceptable standard deviation. So next we go to the analyze mode of the biometer, and here we have the freedom to check the alignment of the eye from the OCT image, review the measurements, whether they are accurate, look at the quality indicators in detail for every measurement that we've taken. Then we also have the option of looking at the keratometry Myers of the patient to see if the ocular surface was good. And at the same time, it gives us the freedom to check all the boundaries of the A-scan waves according to the OCT image, and we can drag and drop them according to need. For example, if there's an ICL, the ACD would be less. So accordingly, we change the ACD from the map. The machine is also loaded with the Alcon Vision Planner, and this reduces the transcription errors, and it is very intuitive to use and helps in surgical planning at the machine. It is loaded with all the new generation as well as the older generation formulae. The full Barrett suite is available, but what we've been increasingly using over the last 1.5 months is the Barrett True Axial Length formula, which is tailor-made for this machine because it uses sum of segments axial length. So in the Vision Planner, I plan my incision location, I can calculate my SI, and I have my preferred formulae and IOLs which I use regularly. At the same time, by using different IOLs, I come to know what is the residual astigmatism, and I can plan my surgery accordingly. This is how the reports of the biometer come, and they are very intuitive and simple and easy to decipher. For example, on the left-hand side of your screen, you see the printout with all the demographic data, the actual measurements which have been verified, and the clinical picture which goes into the image-guided system in the OT. And at the bottom, you have the preferred IOLs and the actual IOL power that you're going to use. If you go into details of these measurements, you have all the detailed measurements and their quality parameters available to you on a single sheet. And on the third part of the report, you have the OCT scan and the correlating A-scan wave parameters along with it. So these swept source OCTs, and especially the Argus, has faster acquisition, gives multiple parameters, has better penetration, intuitive interface and easy to use, is combined with the vision planner and combined with the very own image guided system which we use regularly. If we look at the penetration of these OCTs, now all the swept source OCTs have much better penetration compared to the previous generation OCTs. But if you look at the Argos, it's at the top of the line. And if you look at all the reports that have come in the literature over the last 6 to 7 years, they all show that the Argus has the highest penetration in all kinds of cataracts. But where it really stands out is in mature cataracts, where you get a 90% plus rate of penetration. And my personal experiences, no financial interest, but my personal experience is that in the last 1.5 years, we've not had to use the A-scan at all in all our patients. So what this results in is a massive saving of time for us, because we don't need to use the immersion scan or the A-scan. And what studies have also shown is that if you're looking at the overall efficiency of your workflow in the OT, then it can give rise to a gain of almost 60% of time saved for us. So in summary, if we are looking at advantages of these swept source OCT biometers, is that the fast acquisition, of course, we're able to get axial length in most cases. It has reliable and repeatable keratometry, multiple parameters tested, like you can use these parameters for your ICL planning also. All parameters are checked by the machine for quality and reliability, and at the same time, we too can do that. Then, of course, validation is important with other machines, and integration in the image-guided cataract surgery system. Thank you.
Very nice presentation, Dr. Ajit. I mean, my question would be, you did mention that the penetration with the Argos is better compared to the other currently available models, and it's a very important advantage. What are the other features unique to this, of the machines? This has been the latest addition to the armamentarium we have. How does it, are there any other factors in which it scores over the IOL Master or the Anterion?
I think what is very important is that you are getting a real-time OCT image on the screen when you are measuring. So if you can see at the same time whether the eye is aligned properly or not, whether there's a, for example, if it's a mature cataract, and in a mature cataract you're always wondering whether the fixation is going to be at the fovea or not, or whether at the visual axis or not. Now in the IOL Master 700 you have the foveal focus. You don't have that here, but the machine captures the image and you can see the OCT. At the same time, you are able to see the alignment in real time. So if you see that in real time the alignment is not good, then you are sensitized to the fact that this measurement may not be accurate. The other thing is the keratometries I find are outstanding, because the measurement is in a very small part of the cornea, the central visual part of the cornea. And we've seen it correlate extremely well with the IOL Master 500, IOL Master 700, and also the iTrace topo keratometries, which are in the central 3 millimeters. So I find extremely good correlation. And we validate our findings between the auto-K the eye trace topo as well as aberrometric case and this machine, and we find excellent correlation, especially for torics.
What machine did you have earlier? The AIOLMaster?
I had the ILMaster 500.
500.
500.
And you preferred this to the did you take a sort of a demo of the 700 versus the Argos?
I had access to 700 for a couple of years before I planned on this, but my main deciding factor besides this was that I was almost about to buy the 700 because of the non-availability of this, but the clinching factor I found was the compatibility with the image-guided system. Now, I've been using Verion for the last almost 5-6 years, and this is, it's a seamless progression because the same image, same data gets used for the Verion in the image-guided system in the OT.
You definitely found it an advantage over the AIOLMaster. That's what I wanted to
Yes, it did, yeah.